You eat an apple, you digest it, and your metabolism is going to take those nutrients from that apple, all of the enzymes and minerals and everything that apple has, all the antioxidants, and you're going to get it into the bloodstream, and the rest of it's going to go into the waste. But without a good functioning thyroid, none of that happens.
And thyroid is one of those areas that just gets overlooked routinely. If you've ever experienced fatigue, unexplained weight gain, if you notice feeling more blue or depressed, dry skin, dry hair, constipation, all of these things could be because of a low functioning thyroid.
Depression, it's interesting. I read an article recently by several psychiatrists talking about how hypothyroidism is one of the key components of depression. That's a big one.
You are the expert on your body. If you are feeling fatigued and you gain weight easily and you just don't feel like yourself, more depression, more headaches, all of those could be connected back to the thyroid. If you've had a first brush test, that's all it was, and there are much more ways that we can look at that and to get deeper with this, but you're the expert on yourself.
Welcome back to Rethink My Health Radio Show. Each week we come to you from our studios in Atlanta, Georgia, talking about innovative healthcare topics that are right for you, your family, your loved ones. And as I say time and time again, they are for the research scientists, the practitioners, the doctors in the trenches, working day in, day out, finding out innovative treatments, progressive treatments, integrative treatments that get to the root cause. Our show is about education. It's not here to replace your doctor. It's not here to give you medical information that you can use and take care of yourself. It's really to galvanize you to think outside the box and to make the quality of your life better. We are living in exciting times right now in our healthcare system. Why do I say that? Because change is coming. More and more Americans are understanding that our healthcare system is broken, and we need real answers to help our society, our friends, our family, our loved ones to really have optimal health care. We are seeing chronic diseases all-time high. We're seeing heart diseases all-time high. Cancers, autoimmunity all-time high. So we need real strategies that you could take home and take action with. Today's podcast and radio show is very interesting because we're going to be talking about a very, very tiny gland. It's the size of a butterfly, but it literally is responsible for so many functions. And that gland is the thyroid gland. Hypothyroidism, Hashimoto's disease, hyperthyroidism is also extremely difficult not only to diagnose sometimes because there are some hidden symptoms and there are certain things that a lot of practitioners are not aware of. So we're going to delve deep into hypothyroidism. Joined with me in the studio today is my colleague, Dr. Cheryl Burdette. She is a leader in functional integrative medicine. And as I said time and time again, integrative medicine is just good medicine. It combines East, we're meeting West, and it also looks at root causes, talking about traditional medicine and natural therapies. And that's why we at Progressive Medical, which this show is sponsored by, practice integrative medicine for the past 27 and a half years. That seems like a lifetime, but we're ready to go another 27 years because we're excited. I recently just got back from a functional integrative show called the A4M. It's forward-thinking physicians looking at aging and longevity. And when they first started this organization, I believe it was 1995 or 96. I was at the first conference, Dr. Burdette, and there was only a handful of physicians. I might have been 50, right? There were 9,000 attendees at this show. That just tells you how much is going. 9,000 100,000, which is unbelievable. But they had all kinds of different topics. They were talking about hormones. They were talking about longevity. They were talking about different strategies to delay the onset of aging. But really what it was about was chronic disease management. And the thyroid was definitely one of those topics. And one of our future shows, we're going to talk about anti-aging strategies, longevity. But I want to devote this entire show to the thyroid. Hypothyroidism is affecting millions and millions of Americans. And it's misunderstood because a lot of doctors and other licensed practitioners are only focusing on one test, which is called the TSH. So let's talk a little bit about what is hypothyroidism, Dr. Burdette. Give us your feedback on the research that you've done on why this is such an important gland, because I want to delve into the metabolism for a minute. And a lot of individuals believe that metabolism is just about weight loss, but it's not. Your metabolism is responsible for all physical and chemical reactions of the body, including the degradation of food sources and the assimilation. So what that basically means is this. You eat an apple, you chew it, you digest it, and your metabolism is going to take those nutrients from that apple, and it's going to take what it needs, okay, all of the enzymes and all of the minerals and everything that apple has, all the antioxidants, and you're going to get it into the bloodstream, and the rest of it's going to go into the waste, and you're going to defecate it out. That's how important. But without a good functioning thyroid, none of that happens.
Absolutely. And thyroid is one of those areas that just gets overlooked routinely. And part of that is because we just haven't updated reference ranges on testing. So if you've ever experienced fatigue, if you've ever experienced unexplained weight gain, if you notice feeling more blue or depressed, dry skin, dry hair, constipation, hormonal imbalance, all of these things could be because of a low functioning thyroid. And just because you find out your thyroid function is low, it doesn't mean that puts you on a course of medication for the rest of your life. You may use some medication, and it turns out in this area there are even natural medications that can be prescribed, but there's a lot of root work that can be done to really help to fix what's happening in the thyroid. So thyroid hormone, when we really just boil it down, it is so nutritionally dependent. For example, to make a thyroid hormone, I need an amino acid that comes from protein, that's called tyrosine, and I need a mineral that often comes from the ocean, things like algae, or maybe even our salt, our iodinized salt, iodine. So tyrosine plus iodine, mineral plus amino acid are the things that you have to have in order to build thyroid function. So right off the bat, we can see if you're nutritionally compromised, you just won't do as good of a job here. But to your point, people think metabolism, and that's true. It does really help you lose weight. So if you've been stuck in place, it could be a thyroid issue. But metabolism is not just weight loss. It's how we manage hormones. It's how we remove inflammatory mediators from the body. It's how we control the whole system, your metabolic rev, which is weight loss, but it's monitoring and managing all those other systems in our body too.
Absolutely. And I'm so glad you mentioned about what the thyroid consists of. Once again, it's a small gland the size of a butterfly, but it's packed with amazing abilities to control and enhance the metabolism. And we mentioned a little bit about what metabolism is, but, looking at the thyroid, and this is one of the areas that a lot of practitioners, they learn this in medical school, where they just do the thyroid stimulating hormone. They may now do the T4, maybe the forward-thinking ones are going to do T3, but they're missing other components as well. But the thyroid is made of tyrosine. So T3 is made of diotyrosine and also monotyrosine, which is dio is 2 molecules of iodide, and also 2 molecules of tyrosine, which is an amino acid, and 1 molecule. And T4 is made of diotyrosine plus diotyrosine. So basically, your thyroid is made of nutrition. Now, if you ask a lot of conventional doctors, they'll basically just say, well, if you have hypothyroid, which the TSH is elevated, they're going to give you a synthetic medication called levothyroxine is one of the main ones that they use. Like a Synthroid, they still call it Synthroid. And that converts to T4 converts to T3 in the liver. T3 is the most active. A lot of functional doctors look at it differently. They're going to look at other sources. Does the body need these amino acids? Does it need these minerals? And a lot of them are also using a natural thyroid that's made from a desiccated form of a gland from an animal source. Could be bovine or could be porcine. So a lot of individuals don't realize that. And that's a great way to nourish the thyroid. But I want to get into the testing right now because I think it's really, really important. There was a physician back in the 30s, 40s, and 50s, and his name was Dr. Broder Barnes, M.D., and he wrote a book, and he documented all of the hypothyroid symptoms, and he actually would use the Barnes basal temperature evaluation, and he was correlating that a low body temperature, in addition to a plethora of symptoms as well, which we're going to kind of go over some of those, that a low body temperature correlates with subclinical hypothyroidism. So in other words, you can go to your doctor. You could have all of these symptoms: cold hands, cold feet, constipation, irritability, brain fog, inability to lose weight, excess weight over a period of time that's been slowly coming on, and basically have a normal TSH, because the reference ranges could be slightly higher at a functional trained practitioner. We like to see the TSH between 2 to 2.5. We even consider 3 not optimal. And basically, look at the TSH as a regulator. It's almost like a thermometer, right? So high means that you have low thyroid, and low, really low, means you have too much thyroid floating in your system. It's almost like a thermostat regulator. And a lot of times, patients may have upper normal of TSH, and that doctor will say, you're perfectly fine. Yet you have all of these symptoms going on, and you just can't figure out what's going on. And what happens is all these symptoms go missed, and then Broder Barnes came up with this basal temperature. Put it under your arm, and typically below 97. And a lot of patients were 96. A lot of women out there listening to me right now remember their doctors talking about OBGYN if you want to get pregnant. You can certainly do it for that. But a lot of individuals have low basal temperature, and it's called subclinical hypothyroidism. And that still needs to be treated. So, Dr. Burdette, we've seen in the past 20 plus years, you and I working together doing research, good physicians missing this mark. And I call it practicing medicine by the numbers. Why is that a bad strategy, just to practice medicine by looking at the lab report and discounting the patient's symptoms?
Well, because when we look at a lab report, we don't know where the person was before they had symptoms necessarily. In general, in the case of thyroid, you are moving around, you're living your normal life, you have good energy, good quality of life, and then all of a sudden now you don't. And so at that point, that's when you go to take a test. So that's your baseline. But what we know is that it's much likely that your baseline was higher before that. So let's say that your baseline was a high normal result, not high, but at the upper end of a normal reference range. Now, all of a sudden you've fallen about 80%, which is going to put you at the bottom of the reference range, which is still considered normal. But for your body, that was an 80% drop. You're within the range still, but that is not your normal. So what happens a lot of times in terms of thyroid treatment is somebody will look at it and they'll say, well, you're in range, but you're just very barely in range, or that's not normal for you, or you would feel best if you were at the upper end of a normal range, which is still normal. And there's this mentality of, well, if you're in the range anywhere, then that's good enough. It's not. We see this all the time, that symptoms resolve as your thyroid becomes optimized, not just barely clinging to the bottom of the range. And so whenever I see that, if there are symptoms and there's room within the reference range, then we're going to work to move that up. Now, the good news is many times we can start nutritionally, and that will be effective. It turns out that nutrients, even like zinc, can increase serum thyroid levels as much as 30%. It turns out that there are studies showing that good, healthy flora will influence the amount of your more active thyroid hormone, T3. So in some thyroid patients, we might well be looking at the gut. We might well be thinking about their microbiome, because if we can restore the microbiome, then we can restore their thyroid numbers. So that is just the tip of the iceberg. Essentially, getting a thyroid diagnosis doesn't mean that all we want to focus on is your thyroid. We want to think about you, the human, the host of the thyroid, and how all of those things interact with it. And it turns out there are signals sent from your gut, your GI tract, from your microbiome that influence the thyroid. Those nutrients influence the thyroid. There's something called the adrenal glands that have to respond to stress that also influence the thyroid. And so when we start to tick through these various areas, what we quickly realize is treating the thyroid is not just dishing out a medication. It's a whole person approach, thinking about what nutrients you're low in, thinking about your gut health, thinking about what you're eating, even certain exercise, thinking about, just a whole host of things, because all of that can normalize thyroid function and keep you from needing more and more and more every year.
Thank you, Dr. Burdette. I totally agree with you on that one. Hey, this is Rethink My Health Radio Show, coming to you from Atlanta, Georgia, in our studios. We're talking about metabolism. We're talking about hypothyroid symptoms. If you are suffering from crushing extreme fatigue, unexplained weight gain, persistent constipation, feeling constantly cold, numbness, dry skin, hair, brittle nails, hair loss, depression. It's interesting. I read an article recently by several psychiatrists talking about how hypothyroidism is one of the key components of depression. Mm-hmm. That's a big one. Muscle aches and pains, feeling puffiness around the body. These symptoms develop slowly, and they can also mimic other conditions, especially autoimmunity. We're going to talk about Hashimoto's after the break in a minute. However, sometimes your blood, especially the TSH, may just be hovering. And that's why I think it's hovering above normal, okay? It could be like right there at the cusp, because some labs report over 4. Some could be 4.5. Even some labs are 5 and above. Anybody at 5 is definitely hypothyroidism. Anything above that, you're grossly hypothyroid. This could be fixed by proper nutritional strategies, medication when necessary. Go to your physician to ask about that. Even if your doctor gives you synthetic T4, that can assist you as long as you use these other nutritional strategies and lifestyle strategies. The bottom line is this: lifestyle medicine is critically important to combating all of these chronic issues. We're coming up to Christmas. Christmas is coming up in a week or so. Can't believe how fast it's coming up. And we're all going to be celebrating, which is fantastic, and spending time with our family and loved ones and celebrating the birth of our Savior. But, you know, what ends up happening there is that we have a tendency to overdrink, to overeat, to not have the proper exercise and movement. And this is why it's so important that if your thyroid is sluggish, you're going to feel those effects even more. I'm not advocating that you go out there and be gluttonous over the holidays. I'm not saying that. However, it does happen when we're going to functions or we are overeating. We're making unwise choices. I encourage you to make wise choices, but having a sluggish thyroid will make it even much more difficult to function. And this is why every new year we have something called a New Year's resolution. I think a New Year's resolution is okay, but that New Year's resolution should be done sooner throughout the year. But that's a different topic and story that we can talk about. But I want to encourage you to go to your practitioner, to seek out a functional integrative practitioner. If you're listening to Atlanta, you can come to Progressive Medical. Progressive Medical is sponsoring this show, Rethink My Health. This show is devoted to education, to helping you understand certain aspects of health and how you can navigate through all of this information that you're seeing online, yeah, there's a lot of great information online. But you always have to have a skilled practitioner. At Progressive Medical, we have medical doctors, naturopathic doctors, nurse practitioners, health coaches, dietitians, registered dietitians, and a whole team devoted to help you navigate through this maze. So, Dr. Burdette, I listed some of these symptoms, and a lot of times patients will go to their doctor, especially somebody that's suffering with depression and anxiety. And they're popping all these medications. And a lot of times, these well-meaning physicians don't have the time to go deeper. What are your words of encouragement for our listeners that have been to the doctor and the doctor says, you're normal, your blood work's perfect, but you still have all these symptoms? What do you suggest?
And especially as you mentioned, depression. So maybe let's add to that you even tried an antidepressant and you didn't really feel better from it. It's likely that your issue wasn't serotonin. That's what antidepressants tend to increase, a neurotransmitter called serotonin. It's likely that then, okay, if that didn't work, what else can we think about? And thyroid is a really good contender in terms of why you might feel more depressed. Now let's add to that. Let's even say you noticed all this happened post-pregnancy, postpartum depression. That's really tied to thyroid function as well. Doesn't have to be, but if you've been struggling and you feel blue and you've tried some conventional approaches and they didn't work, it's probably something else. Thyroid is a great bet. Now, add to that, maybe you feel a bit more fatigued. Maybe you notice constipation or dry hair, thinning hair. All of that can be traced back to thyroid function. And this, how we're talking about the holidays here, how we see that, okay, maybe you splurged a little and you're like, but why? Why did one day add 3 pounds or 5 pounds? If it just seems abnormal, then likely it is. You are the expert on your body. And so trust your instinct, not a reference range that the Journal of Endocrinology says misses half the population. So that's another problem with testing, is that we already know it misses half the people. We have to think about symptoms. So if you have symptoms and you've tried some of the standard things, for example, for depression, and they're not getting you there, it's time to think within another parameter. It's time to think within functional medicine and to really look at that from a different angle.
And I like the word functional medicine. And we talked about integrative medicine, that you take the best of all the modalities of traditional and complementary naturopathic. Functional is really another term that we use to see how the body functions and how the body is working from a physiological perspective. And that's why I want to encourage those out there. The thyroid, that small, tiny butterfly gland, is so important to achieve optimal health. You may not need a medication. I know sometimes the word medication scares you, and some patients say, I don't want to be tied to a medication for the rest of my life. But the fact is, this is food. This is nourishment for your gland. Sometimes you do have to be on a medication, especially if you have all these symptoms and the TSH is well above 5. 100%. You may need to be on a medication. It could be a natural medication, but you need to be on something. It's not going to get better on its own. You need to nourish that thyroid. And we talked earlier about T4 and T3. It's made up of these 4 molecules of tyrosine, which is an amino acid. Amino acids are the building blocks of life. We get them from food sources, but if your metabolism is not working, you may not get it. So that's why you must possibly supplement for tyrosine. And iodine is so critically important.
Absolutely.
And one of the reasons why that we have an iodine deficiency is our mineral is deficient. There was a document back in the 30s, Senate document 262, and it measured all the minerals in the soil. And we had less than 30 minerals back then. We should have 100 minerals in our soil. So iodine is very, very important. I encourage all of you out there to get tested before you do any of these therapies. See a licensed practitioner first and find out if you're a candidate for subclinical or hypothyroid or Hashimoto's. Hey, when we get back after this break, we're going to be talking about root causes with hypothyroidism, and we're going to delve deep on something called Hashimoto's, that's a mouthful, disease, which is an autoimmunity disease. And Dr. Burdette, I know that you spent a lot of time researching Hashimoto's, and you've treated thousands of patients and lectured physicians all over the world. It's becoming an epidemic right now.
Absolutely. And so this is something that you want to, again, think about the whole person. We're not just looking at the thyroid, but why is the body attacking the thyroid? That's an autoimmune condition. And some of the most successful ways to treat an autoimmune condition are to think about the whole body. We have to think about gut-based health. We have to think about the hormonal axis. So we have to think about adrenals, and we have to think about tissue health and antioxidants.
Absolutely. Well said. Hey, this is Rethink My Health Radio Show, coming to you from our studios in Atlanta. If you're hearing us for the first time, we welcome you. This show is about education. This show is about galvanizing you to take action for your health. It's not here to replace your primary care physician or your medical doctor. It's not here to give you medical advice. We're here basically to educate you. Education is the key to beginning that journey of optimal wellness and health. We right now have to start a revolution, and that revolution for healthcare starts with you. There's no doubt you're reading in the news, healthcare expense all-time high, insurance premiums all-time high, going to the hospital, which, listen, thank God we got great hospitals in our country, great urgent care. This is where traditional medicine works. But for chronic disease, we are falling short. So we need strategies. We need to be proactive rather than reactive. And that's why we're bringing you Rethink My Health. We want you to start thinking about it, especially during the holidays. We want you to enjoy your family. We want you to enjoy the festivities, have a great time, enjoy your celebration of your Savior, but at the same time, be responsible. And that's why we want you to be as healthy as possible. We will be back in a moment after this break on Rethink My Health. This is Dr. Gez Agolli, your host. Okay, welcome back. Rethink My Health Radio Show. Great topic, Dr. Burdette. We're really delving in deep into hypothyroidism. Small, tiny gland, size of a butterfly. So important, packed with ability to enhance your metabolism. It is part of your metabolism. Without this gland, your whole body doesn't function optimally. So we talked a little bit about, from a functional medical perspective, what needs to be done, and that all testing, which is necessary at times, but there are other symptoms as well. I want to really delve deep right now into something called Hashimoto's, and Hashimoto's seems to be a huge factor with many, many Americans right now. Statistically, we are now seeing well over 30 million Americans, some reports even higher, that are suffering with hypothyroid. It could be complete hypothyroidism. It could be subclinical. Hashimoto's is a large part of that as well. And we're talking millions of Americans with Hashimoto's. A lot of them don't even know they have it.
Yeah.
And sometimes it's not regularly tested by physicians. And it's interesting. A lot of patients basically say that their practitioners will tell them, well, if you have Hashimoto's, there's not much you can do about it. And literally you have it for life. And we're just going to challenge those statements. There's a lot that you can do about it. There are root causes. So let's get into Hashimoto's. Number one, what is Hashimoto's? And then let's get into how you test for it.
Yeah, so as we left for the break, we were talking about how it falls under the umbrella of autoimmune conditions. And what that means, your immune system is attacking yourself. So your immune system's become confused, and it's now attacking your own thyroid hormone, your own thyroid tissue. And so this will drive down the function, and we will be fatigued, and we'll gain weight easily. And we're back to that laundry list of symptoms. So the way that this often works is you go in, you explain that you're fatigued, you're not feeling like yourself. Your doc does some lab work. They do a partial test of the thyroid. They tend to look at the thyroid hormone, sometimes not even the most active T3, and the signal that the brain sends to the thyroid. However, None of that looks at whether or not you're attacking your own thyroid. So you do that lab work, it comes back, they go, oh, it's normal, you're fine. And you're like, I'm not fine, I'm still tired, I don't feel good. And so consequently, what that means is that what should happen is, oh, okay, well, we looked at part of your thyroid function, let's measure these antibodies and see if that's out of range. And so, but yet, the conversation stops and you're told everything's fine and everything's normal. And it's not. Again, you're the expert on your body. You say when everything is fine and everything is normal. And like we're saying, often they start with a very watered down glimpse of the thyroid and they never even go on to look at these antibodies. So this is something that we do routinely, and we know that there are nutrients that lower these antibodies. You mentioned iodine. Not only does it build your thyroid hormone, but it helps to reduce autoimmunity as well. There are nutrients like selenium and glutathione that make the thyroid tissue function better. When that happens, our immune system gets less confused and doesn't attack it in the same way anymore. Also, we know that the root of autoimmunity, whether or not it's rheumatoid arthritis or in this case, Hashimoto's and the thyroid, is getting back to the gut. So if you're trying to improve your thyroid function, you need to think about what you're eating. You need to think about even doing a stool test that looks at your microbiome, because what we've seen is that a healthy microbiome allows you to make more thyroid hormone and less antibodies that attack your thyroid. And if we have bad bugs in our gut, defined as dysbiosis, that can tell your brain to make less thyroid hormone, and that dysbiosis will decrease the receptors that thyroid hormone binds to. So it could all look normal on paper, but you're not getting that lock and key fit. You're not getting the hormone to go to the receptor, and so consequently, you still feel miserable. You've got to look at the whole picture.
Yeah, and unfortunately, a lot of practitioners are not looking at the whole picture. Statistically, and this has been reported over the past 5+ years, that approximately 5 to 10% of patients diagnosed with hypothyroidism have Hashimoto's, and it goes undiagnosed. Mm-hmm. And you need to have that blood test for the antibodies, the TPO antibodies, and that's a simple blood test, of course. But then what do you do with that information? Okay. And this is critically important because, as Dr. Burdette so eloquently said, your immune system is attacking the thyroid gland. And that becomes debilitating at times because that disrupts your entire metabolism. That's going to cause tremendous amount of inflammation. That's going to cause some cognitive issues, irritability, and a lot of times frustration in that particular patient, because a lot of times you're going doctor to doctor. It's not a quick fix, okay? And there are some research scientists out there. As a matter of fact, I've been to some seminars. It's been about 10 years or so. And Dr. Karazian, he did some research on gluten sensitivity. I'm not saying this is 100% with everybody, but what's interesting is that a lot of these patients did have a gluten sensitivity, not an allergy, not celiac, a sensitivity. So you either get tested for that. There's certain tests. There's a blood test that looks at something called IgG. Mm-hmm. That could be a sensitivity, or something called a complement with gluten. Also, gliadins that we see, and there's a saliva test that we look at, and we look at secretory IgA, which kind of measures the immune function. If your immune function is overdriving, and some of these are key components, but something is simple, okay? For those of you out there that may not have the ability to get tested, or may not have the ability to go to a practitioner for a period of time, we encourage you to find a practitioner. But sometimes just eliminating glutens could be a key component. You still have to heal the gut. You still have to get tested because you may have other pathogens in the gut. But we have seen a correlation with gluten sensitivity or intolerance that could exacerbate these antibodies.
Absolutely. And not only do we hear this in different lectures that we attend, but if we go to the peer-reviewed medical research, I can find at least 8 to 10 studies that show when people pulled gluten out of their diet, which predominantly comes from wheat, that these antibodies go down. Is it absolutely a magic bullet? Of course not, but it is something that we should consider. And it doesn't really cost you anything to change your diet. You have to eat something. So taking wheat out, you put other things in. It's just it's a net, same in terms of what you're spending there. And this can lead us into healthy directions. However, if you've gone in and tried to have a conversation about your thyroid with your doc, and you're left and you're being told everything's normal, but you're still fatigued and don't feel like yourself, and there was no conversation about diet, no conversation about things over your overall health, then there are still things that you can pursue. That wasn't it. There's more that can be done.
Listen, your doctor is very well trained. They have great training. Family practitioners try to do the best job they possibly can. I listened to recently to a podcast by Dr. Peter Attia, Stanford MD, and he talks about this because he's really forward thinking on longevity and strategies on staying as healthy as possible. And he's a great influencer. And he talks about in Stanford, I had 0 hours in nutrition, okay? 0 hours on wellness and prevention because, they're busy learning other therapies of medicine. So at the end of the day, you need your family practitioner, but they're not going to give you some of this information, some of the cutting-edge information on nutrition, wellness, and thinking outside the box for something like Hashimoto's. Endocrinologists are needed, but a lot of times patients can't even get into seeing an endocrinologist, okay? So there's a lot of things that you have to find a functional practitioner, integrative practitioner to help you with that. Okay, so definitely we think that gluten could play a role. Another area that we have seen, Dr. Burdette, I know that you have been instrumental on pushing through with this, is oxidative stress on that thyroid, exacerbating the Hashimoto's. And I'm talking specifically about glutathione reductase and total glutathione, because I remember you and I were having conversations when we were having a roundtable at Progressive Medical with all the other practitioners, and we came up with strategies on Hashimoto's patients. A, correct their thyroid. B, find out what's going on in the gut through a stool test and a leaky gut test. Correct that. Correct the food sensitivities. That sounds great. And there was always one other missing component, and it was glutathione. And we tested these patients. They had low glutathione. And then at that particular time, we were using a special cream that we literally put around the neck area going into the thyroid gland. And it was unbelievable seeing the test results. We got clinical data on this. Literally, we had patients with antibodies well over 600. Can't even mention the patient's name. We had a bunch of patients, and I remember one in particular. She was shocked because she went to an endocrinologist. She went to her primary care doctor. They said, there's nothing you can do for your heart. Don't waste your time or money. You've got this for life. Keep on taking Synthroid, and don't worry about it. It's always going to be there. And she went down to normal after 9 months, 12 months of treatment.
And this is the thing. Yes, it's not going to improve if you don't treat it, but there are known treatments. And so in the area of thyroid, and this is part of the fun of being at Progressive Medical, is that we see so many patients and we do so many different treatments that we really have our finger on the pulse and seeing new things that shift what's going on. So when we discover research that talked about if your antioxidant status is low within your thyroid tissue, this could be a reason for more autoimmunity, more Hashimoto's. So that Hashimoto's, again, means an antibody. Your own immune system is attacking yourself. And so one of the reasons this can happen is because your thyroid hormone starts to look weird. Well, one of the reasons it can start to look weird is because if it's sitting in an environment of lots of free radicals, then that begins to damage the thyroid hormone. It rips it up, it nicks it, it looks all distorted. And so the immune system says, that's not normal. I'm going to attack it. And so an autoimmune condition to the thyroid is born. So if we can reduce free radicals, which we can by things like topical glutathione creams or changing diet or taking things orally, we know that selenium will work to drive, in fact, your own antioxidant system in the thyroid tissue. In fact, there's an antioxidant system, and when that is low, you have more Hashimoto's. So all of these things improve the tissue health. When you improve the tissue health, then we restore normalcy. So this idea that you're stuck in place, nothing will ever make it better, is a fallacy. If we work on it, if we engage in treatments, these things can get better, and we see it. We know because we're testing. We measure these antibodies, we watch them come down, we watch them normalize, and people feel better.
That's the key. People feel better. And talking about nutritional deficiencies, this is so important. We've talked about this in the past on Rethink My Health. Minerals are the spark plugs of life. And you just mentioned selenium. Selenium supports T4 to T3 conversion, and it protects that thyroid tissue. Critically important. We're not getting selenium in our diet. I encourage those listening out there. Brazil nuts has the highest amount of selenium. I think it's like 50 to 80 micrograms Brazilian nuts. But anyway, we think you should supplement with that. There's certain good liquid. There's certain supplements that have it. Iodine is so important. Interestingly enough, though, if you have Hashimoto's, if you take too much Iodoral or Lugol, sometimes it can exacerbate that inflammation. So there's kind of a balancing act there that we've kind of seen. So too much is not necessarily better for that. Also, zinc is important. I mean, zinc is important for many areas as well for hormone production. Zinc is a cofactor. And I use the word cofactor. Without minerals, you can't make hormones. You can't make essential fatty acids. You can't make essential amino acids. And so it's critically important. But specifically with zinc, it's required for hormone synthesis. Hormones are like a symphony. They have to work in sync together. Too much of one hormone affects another one. Too little of one affects another one. There's a kind of a balancing act. And I kind of given this example. If you ever go to a symphony and you hear hear this great music out there, this orchestra, you have a conductor, and that conductor controls every one of them. It's like hormones. The conductor is the pituitary. And, a lot of doctors don't even test for human growth hormone or something called insulin growth factor, IGF-1. So you got to kind of look at the whole picture here as well. And also vitamin D. Vitamin D is so important. It regulates the immune system. And there's been data showing that it could make Hashimoto's better by preventing the autoimmunity. Okay, because vitamin D has so many different mechanisms of action, well over 2,000 mechanisms of actions. And so, it's so important to look at all these nutritional issues. And yeah, you can just take your thyroid medication. You have to replace these deficiencies. We're not getting them from our diet. Unfortunately, even if you're on an organic diet, which is great, we are still nutritionally deficient.
Absolutely.
And that's important to understand.
Yeah, the soil just doesn't have the nutrients that it used to. Crops just grow at different rates. They're lankier. They don't concentrate the nutrients that they used to. So we have a lot of uphill battles against us in terms of maintaining good thyroid function. But that also, we can look at it in a glass half full kind of way as well. What that means is that repleting these nutrients can have meaningful shifts in your thyroid function. So I think many times people think about their thyroid and they're like, well, I don't want to get started on a medication. I'm just going to need more over time. Well, specifically in this example of autoimmunity and Hashimoto's, what we see is those people are often taking some thyroid medication, but then as you treat these antibodies, as you normalize that thyroid function, they need less thyroid medication. So that's absolutely a possibility as well. And you're going to feel so much better when we look at these things.
I totally agree, Dr. Burdette. And, it's interesting. A lot of patients will come in saying, oh, my gosh, do I got to stay on this medication the rest of my life? And, once again, nothing is absolute. But when it comes to quality of life, a lot of these thyroid, whether it's a medication or whether it's a glandular or nutritional supplement, I want you to think of it this way. It's food. And the answer to the question is, are you going to eat food for the rest of your life? Okay. So the reality is, it just depends on what your goal is for quality of life. It's one of these areas that you need these nutrients. We talked about this. T4 and T3 need nutrients, selenium, iodine, zinc, vitamin D, all of this. And sometimes you're going to need a medication. You're going to need to possibly up something called glutathione. We can talk about that. Okay. The last portion of the show. We want to thank our listeners, our loyal listeners coming to us each week. This is Rethink My Health, sponsored by Progressive Medical Center, a forward-thinking, innovative, functional, integrative clinic. For the past 27 and a half years, we've surpassed over 55,000 patients treated for chronic issues. So we're excited that we've been around here for that long, constantly doing research. I want to finish off this show on thyroid issues and Hashimoto's. And I want to talk about the correlation between another gland, cortisol, stress, and thyroid matrix. And Dr. Burdette, I think this is very, very important because a lot of patients are diagnosed with hypothyroidism or Hashimoto's, and they go through the treatment and they do all this thing, but yet they're missing the adrenals. What's the correlation? When should you take a look at this? And how do you correct a cortisol thyroid? Because sometimes you think it's thyroid, but it's really cortisol.
Mm-hmm. Well, it's like you could think about it this way. I could probably walk with one leg, but it would be really, really difficult.
You'd be hopping.
I'd be hopping. Yeah.
Hopping Dr. Burdette.
And so thyroid relies on adrenal function and vice versa. So now if I optimize both of those together, I'm walking on two legs, or maybe I'm even running by now, because, and that really is a good way of thinking about it. One needs the other and vice versa. And so maybe you've seen somebody and done some in-depth thyroid work, but yet you're still fatigued and not feeling like yourself. Well, then now it's time to make sure those adrenals are optimized as well. So for example, if adrenals don't work like they should, we don't make adrenaline. That probably already makes you understand that you'd be tired. But if we don't respond to stress like we should, stress hormones, those stress hormones can inhibit our thyroid function. The thing that helps us handle those stress hormones is our adrenal glands. And so now when we work on both of those together, I'm walking with both legs, and I'm skipping, I'm jumping, I'm running.
I love that analogy. Skipping, jump. You need to be running, sprinting. We'll get to the point of sprinting. Okay, which
Absolutely.
Is definitely a great exercise. Short term, of course, short bursts of that. Okay, so I totally agree with you on the cortisol. What type of testing do you recommend for that?
Yeah, so I think the best way to do this is going to be actually through your saliva. And the reason that's true is because what we want to know about the adrenals is not a spot check, not a one-time value, because adrenals do different things at different points of the day. In the morning, you should make more adrenaline, get up and go hormone, so you feel like getting out of bed. By evening, we should make less adrenaline, so we know when to go to sleep. So there's this circadian rhythm to the adrenals. And so this is why we do salivary, because it allows us to look at the adrenal glands 4 times throughout the day, not just a spot check at one time or the other. Because let's say you're a morning person, you get out of bed okay. If I look at your adrenal function through blood in the morning through a blood draw, that might be okay, but you don't sleep at night and you're fatigued by 3 p.m. and you really wish you could nap. Well, that morning draw doesn't tell me about what those adrenals were doing at 3 p.m. or before bed. It's different at different times in the day. And so you could go in and get 4 blood draws. You'd need to get one first thing as you woke up, in the middle of the afternoon, late afternoon, and right before bed. That's horribly inconvenient. So we can do this through saliva. It replicates your normal daily rhythm when you're in your home space, your workspace. And that's what we want to see. How is your body handling stress, the resilience to that when you're in the throes of day-to-day life?
Being resilient is the key. And that's why it's so important. If you're going to get evaluated, you have to look at the adrenal function as well. That's in a complete evaluation, thyroid and adrenal. I know this could be a lot for certain individuals. But once again, if you are experiencing crushing fatigue, if you have tried everything, you're not getting better, it could be that you've been misdiagnosed with thyroid and misdiagnosed with adrenals. They go hand in hand. We got a few minutes left. We're here on Rethink My Health. We have a great show talking about the small gland the size of a butterfly. It's so important to take heed of this advice and to take action. We didn't really have time, Dr. Burdette, but I just want to touch up just briefly a little bit because I think it would be remiss not to mention some environmental and toxic triggers or medications. We call these endocrine disruptors. Mm-hmm. And I think it's important just to mention this briefly because plastics all-time high. You're seeing this in the news right now, and scientists are talking about these microplastics. They're endocrine disruptors. Heavy metals, pesticides can alter It's the signaling. You got to remember the body has trillions and trillions of cells, 30 trillion cells, by the way. That's a lot of cells. These endocrine disruptors, briefly, just tell me succinctly why it's important to take a look at this and what can we do about it.
Well, they block your hormone function, and so that's not going to show up on a standard test at all. In fact, we look at studies where toxins can concentrate right there locally in the thyroid gland, and so at Progressive, we can help you in terms of what botanicals help to move that thyroid gland. There's specific research with things like green tea or glutathione being able to detox the thyroid gland, iodine detox the thyroid gland, and so many times it might not even be about a medication or replacement of the thyroid. It's just getting the junk out of the way.
I totally agree.
And your body is wise and it will function as it should.
Absolutely. And that's why I want to mention that, because we live in a toxic world. We live in a fallen world. And that's why, yes, you should get your thyroid checked. Yes, you should do your adrenals. Yes, you should possibly be on medication supplements. But guess what? You have to think outside the box. And part of that, and part of this journey of wellness is involving a team. We are a team, and you need more like-minded individuals to help you get to the root cause. And sometimes these are chemicals, these are heavy metals, they accumulate and they function and they affect the functionality of your body. And that's why detox is critically important. Hey, Dr. Burdette, we only have about a minute left on the show. Any last words of wisdom talking specifically about thyroid health for our listeners out there? What's one of the first steps they can do?
To remind yourself that you are the expert on your body. If you are feeling fatigued and you gain weight easily and you just don't feel like yourself, more depression, more headaches, all of those could be connected back to the thyroid. If you've had a first brush test, that's all it was. And there are much more ways that we can look at that and to get deeper with this, but you're the expert on yourself.
Thank you, Dr. Burdette. Hey, this is Dr. Gez Agolli, Rethink My Health Radio Show, sponsored by Progressive Medical Center. Past 27 and a half years, getting to the root cause. Take action for your thyroid health. Do something about it. God bless you guys. You and your family enjoy this Christmas season. We are going to be back next week talking more about forward-thinking health, getting to the root cause here on Rethink My Health. And remember, Proverbs 17:22, a cheerful heart is good medicine, but a crushed spirit dries the bones. Be cheerful. God bless you guys, and we'll see you here next week on Rethink My Health.